Hello, everyone. Just waiting for a few more folks to arrive. And before we get started on our webinar tonight, just wanted to share with you some housekeeping items. In the bottom bar at the bottom of your screen, if you actually hovered over the blue window, you will see a Q&A feature. If you have any questions that come up during the presentation tonight, please place them there. It gives us an ability to track and curate the questions, and that's what I'll be looking at the end of the webinar to answer those. If you want to chat or have any technical difficulties during the presentation, you can use the chat feature. Again, the Q&A features to curate all of the questions that you may have tonight and for those to be addressed at the end of the presentation. And if you have anything that you want to participate with or have technical difficulties around, you can use the chat feature. So tonight I'm going to speak to you about what I consider the 6 elements of conversion success. And first, a little bit about me. My name is Lauren Tancredi. I am the practice development lead here at Hint Health. I am a serial entrepreneur who's navigated some complex healthcare systems for my own personal needs that led me actually to the business of what I consider to be private medicine. And so over the last decade, I've been really committed to helping establish direct relationships between practitioners and patients through a variety of stages in business, including the launch, growth, and complete practice conversion. I began back in 2008 helping a large hormone replacement therapy clinic and moved from building their affiliate network into practice management, selling $15,000 a year memberships, and quickly realizing that I really had no idea what I was doing when I got started. But I soon became one of the top physician salespeople without being a physician. And so I've taken a lot of my success and experience and rolled it into these elements of conversion success that I'll share with you tonight. I've been working in the private pay or retainer-based medicine space for the last decade or so, and been using Hint over the last 6 years, pretty much as long as they've been in existence, as one of the tools to support our practices in both conversion and onboarding in patients. And so when the opportunity arose to come and work with them and help their practices thrive, it just felt really aligned to me. And so tonight I get to help you in doing the same. My request of you is just to stay open and curious to the process and look for some new and innovative ways that this webinar might bring success to your practice. So a little bit about Hint. Hint was founded to support DPC doctors to grow and expand the direct primary care movement. We take our cues from the primary care physicians and work to build features and services that support their growth of direct care. And right now what we're seeing is primary care in crisis. This fee-for-service, volume-driven nature of many practices has meant, in particular, in early April, that they need to do something to change. And primary care practices reported an average of 55% reduction in revenue, those traditional fee-for-service docs. But at the same time, what we've been seeing across the clinics that are using Hint is that our practices not only are continuing to get their recurring monthly revenues, but they've actually seen a little bit of growth in their patient base. And rather than an insurance company, there hasn't been a lot of terminations. And we know that a lot of the software that we use to support DPC, manage their enrollments, their networks, billing, and employer contracting, Hint is kind of at the foundation of that. And so we're able to aggregate all of this information to share with you. So our mission, again, is to power direct care and make it the new standard. We're launching a program to convert existing fee-for-service practices and organizations into direct primary care models. And I'm going to show a little bit about the steps that you can take to prepare for success in this process. So tonight we'll cover the 6 elements of conversion success. And at the end, we'll also share with you a pathway that will support you in making this happen. That may be easier than doing it alone. So why are you here? Well, you probably have heard about practice conversion before. You might even have some questions like, how do I get started with my direct care practice? Who's my ideal patient? How do I go about converting my practice? You might be unhappy with the status quo, but not sure if you can make the change, or you feel trapped. You have a desire to really make the foundation of your practice between you and your patients, and you might not know what steps to take, and you know that there's a better way. I know that there's a lot of resources out there that can take you from fee for service into direct primary care. And no matter what you decide to do, whether you ask for help along the way or you decide to do it on your own, there are two things that I want you to walk away from here knowing tonight. One, that these elements that I share with you will make a world of difference in whatever you do. So just make sure that you do the work. And the second thing is that you don't have to do this alone. Similar to the way that you're asking your patients to trust you for guidance and care, we are here to do the same, and we'll share with you how to get results from a proven framework that I've used dozens of times at the end of this webinar. So this webinar is ideal for fee-for-service practices who are ready to change the way that they deliver care, for healthcare providers who are dissatisfied with the status quo, and are ready to take some actionable steps to launch what I believe is the future of medicine, a direct primary care model. Many of you are here because you've reached this crossroads in your practice, where you could do what the system is pushing you to independent doctors to do and retire or sell, or be forced into volume over value, or you can explore what you know to be the right way. This may even be what led you to the webinar here today, the hope to move forward in a more enlightened way. So a successful practice conversion can actually help strengthen a company's brand awareness, increase exposure in the marketplace, and generate new patients. If it's done right, it can actually elevate your credibility and reinforce your position as an industry thought leader. However, running a conversion can be intimidating and challenging, but it doesn't have to be complicated. So I'd like to share with you some of the best practices, tools, and resources for planning and executing a highly converting practice transition, which I call the 6 elements for conversion. And I just want you to take a moment to imagine if you were actually able to create a practice that not only focused on the physician-patient relationship, but also gave you a reliable recurring monthly income. So tonight, what will help you cover is understanding your vision, like why are you interested in direct primary care? Defining your ideal patient, that is who you will be serving. Understanding the concept of time and money. What will it actually take you to deliver in direct primary care? The experience, how you want folks to feel, not only your patients, but also the team that you surround yourself with. Communications, how will you share this message of what you're bringing into your practice? And onboarding, what I like to say, how you will teach your patients to use the practice or be with the practice. We'll walk you through effective ways to identify and approach your patients that's simple to follow and explain how you can work alongside us to make your practice conversion a success. So the first thing that I want to speak to is vision. And what I like to think of being as your foundation of your business. It literally touches every element of your business. It's your framework for bringing it all together, and getting clear on why you want to make this change is the first step to success. If you're not clear on your vision, it will be challenging for you to enroll others into what you're creating or empower your team to actually deliver on the services. So what's your vision? I shared with you that the vision of Hint is to power direct care and make it the new standard. And so as business evolves and grows, and our choices and actions get to be aligned with this, otherwise we can't choose it. It also empowers the team and our clients to speak to who we are and what we're doing at Hint. This is the one place that I see a lot of practices fail. Before you get started, I encourage you to get clear, because if you can't articulate your vision, you will not be able to enroll others into it. I had spoke to a doctor in Michigan recently who runs a hybrid practice, and he was feeling really challenged, like to the point where he was about to close his doors. He was not able to convert anybody from his fee-for-service practice into his direct primary care practice. He also shared with me he was spending about $25,000 leading up to the launch of his practice in marketing, to build a site, to drive traffic, and not one sale. I asked him to explain to me what he does in 30 seconds or less, and he couldn't. And I asked him, why is he doing this? And he started to create a story around what it was that he hoped to share. Now, he paid a web developer, he paid a salesperson to help enroll people into his dream, but he had a hard time even articulating it. So it's easy to get an insurance contract, set up shop, wait for the patients to come in, the insurance company lists you on the directory, and it gets you traffic. That's not the case with direct primary care. You'll still be having patients that utilize insurance that need to understand why they can't keep taking your insurance. You get to share with them your vision. Your team gets to do the same. But if you don't know why you're doing this, neither will they. So give them a why. And who's the them? It's your ideal patient. We know this model of care is not for everyone. Some will jump right in. Some will not be able to afford it, or at least they think that they can't. So the question is, who will you actually serve in this model? The second thing that we do as part of the conversion process, and I'd encourage you to do the same, is to understand your patient data. That you're actually designing a membership offering that serves your current population. This becomes an essential piece of the equation. Your data is actually a story of your current patient's experience. It's a great place to begin to understand how patients are utilizing the practice. So what do we look at when we look at our patient data? In preparation for the conversion, we typically look at active patients. Those are defined as anybody who's had an appointment in the last 2 to 3 years. We look at the other data points to support that, including gender, households, frequency of visit, how far they actually are driving to come to see you, your insurance payer makeup, and then match some of that data with the US Census Bureau to make sure that we have an understanding of what your average household income is. We want to make a price point that's feasible for them. We also want to design a membership offer that, based on utilization, gives them value. This insight can be the foundation for your membership design, and it also serves as a tool for your strategic sales approach. We want to ensure that we're speaking to listening ears and designing a membership based upon what your patients are needing. And so this gets conveyed through your marketing and your messaging. In terms of the strategic sales approach, we can identify who's coming into the practice a lot, who actually has the income to support the new membership offering, so that we can target those folks as we outbound our communications plan to them. It really helps us get early enrollments into the conversion process that will set up your long-term success. The third thing that we look at is time and money. Now, this is what I call your house of finance, and it's probably one of the places that physicians rarely touch on a regular basis. It's also where I see most practices struggling. They haven't done the prep work to really understand how they'll be allocating their time and what financial support they'll need in order to sustain their practice. And it's not something that can be overlooked. Now, time and money are not only the most common objections that you'll hear during the sales process, they're also one of the most avoided parts. And so time and money relates to two parts of this process. The first one is how the actual process is laid out. So typically, a conversion will take about 90 days of planning and up to 6 months to define an experience to ensure optimal results. The first 90 days are really just for the planning aspect, turning all of your ideas into concepts, into processes that support the conversion with ease. And in our Convert course, you can do this all in just 6 weeks with only 2 to 3 hours of dedicated time from you and your staff to make this happen. We'll work with you to design your membership offering, ensure that your member capacity can support the financial needs of the clinic. We'll review your financials. We'll design your marketing materials, craft a sales experience, and propose an onboarding process and train your staff to support the goals of your conversion. It's important that we understand what milestones and goals that you want to achieve so that no part of the process is overlooked. Which brings me to the second part of this time and money aspect. It's about the availability of the provider to actually render services to new members. So we look at the membership experience or journey and what you anticipate delivering during this time. We look at the current patient data utilization along with what we see from high-performing direct primary care clinics, combined with your unique skills and talents, and create an overview of how many patients can be served as members, as well as what staffing might be necessary to support the delivery model. From this mathematical equation, we can then find a membership price based upon the anticipated time that we expect to spend with each one of our patients and what the financial needs are of the practice. It's important that you take a deep dive here, looking at your expenses, your debts, your resources from a equipment and staffing standpoint to make sure that we have it all covered. I was recently interviewing practices as we were gathering data for one of our network clients, and one of the comment thread I heard was, I wish I could charge a little bit more. We only have so much time in a day, so much time in a lifetime, and one of the most challenging parts of the process for physicians is valuing their time. After years of being told what they will be paid, direct primary care providers actually have an opportunity to declare and demonstrate their value. And so here's where we help by providing a framework as well as best practices and price points we see working in each market that should be taken into consideration before determining price. Do your research, call your neighboring practices, and look at your finances before you stamp a ticket price on your membership offering. The fourth element that we're going to talk about tonight is the experience. Maya Angelou once said, people will forget what you said, but people will never forget what you did. Or sorry, people will forget what you said, people will forget what you did, but they'll never forget how you made them feel. Makes more sense here. And so all of these elements may happen simultaneously, but as I mentioned before, everything touches everything. So as you begin to craft the member experience, you'll gain an understanding of how you'll manage your time, as well as curate the experience of how your patients will be with you in this new model of care. Anticipating the needs of the patients through the various stages of activation is essential to the framework of this membership experience. During the conversion process, some of the things that I'd invite you to consider is think about the questions that they might have every step along the way. So as they're going through the sales process, why am I buying this? What am I getting for my money? How do I actually utilize the practice? For the new patients, what is this telecommunications thing or telehealth experience? How do I access you after hours? Your existing patients, what's different for me here? My sick patients, how do I access you after hours? What's appropriate to access you after hours? And if I have a friend, how do I let them know about membership? These are all questions that you get to consider as you're crafting the experience, and we design processes around how we actually are able to respond. I also invite you to consider what resources you will be using to support them, whether they're technology or their staffing needs or they're outsourcing to third parties. It's mostly the feeling that I want you to get to as part of their experience. This will help support you in communicating the vision of the practice, as well as ensure that the staff members are able to deliver what I call a remarkable experience that keeps people nurtured and engaged. A lot of the times when I'm designing these processes, I like to incorporate what I would consider NLP or neuro-linguistic programming here and future pacing, right? So for example, when patient signs up, they go through the sales process, they give you your credit card, there's this thing that happens that's like, oh, I've just given you money and now I don't need you for a little while. Why am I paying this fee, right? And so during the onboarding process, one of the things that we would do is communicate the expectations of how things will happen moving forward. With something along the lines of, our clinic will reach out to you once a year for your annual visit. Anything else that you need, here's how to get in touch with us. And we go through all the processes when you need a prescription refill, when you have a sick visit, blah, blah, blah. Every once in a while, you'll think to yourself, why am I paying $75 a month for something I barely use? But that one time that you're sick on the weekend or your child wakes up with a fever in the middle of the night and you're not sure what to do, you know that you have your doctor by your side, and that will never bring the cost of membership into the question again. That's just an example of how you anticipate patients' needs and direct them how to be with the practice. Plus now you have a way to identify what you'll need to deliver on the other side of things, whether it's after hours care or access through a video conferencing app. If it's how you choose to deliver your services. The fifth thing that I think is key to conversion success is communication. What tools will you need to deliver your message and care, for that matter? The communications element accounts for all of the sales, marketing, operational activities that occur throughout the course of membership. This element is initially designed to support the conversion timeline, moving current patients through an educational process to support them in their decision making, and ultimately enrolling or possibly leaving the practice. The final stages of the conversion process is onboarding, as I mentioned before, which can also be used for new members of the practice, which will lead to them into how they continue to communicate and engage with the practice. Having a clear communications plan with a call to action during the conversion process will ensure both patients and staff know what the best next steps for them as they move through something that they've never experienced before. This is your sales system. Most practices will easily draft up an announcement letter, fold it up, stick it in the mail, send it out to all of their patients in their database, maybe 2,500 plus, and hope that the phones ring. Knowing who will answer the phones, who will answer the questions, which steps to take, and how to move patients to action is the essential piece to planning the execution of the conversion process. Then what happens when the phones are ringing? Who do you call first and why? What other levers can you pull to support the education and awareness of the changes that are taking place? Sales is not a one-time thing. This is one of the biggest mistakes that practices make. 80% of sales require 5 follow-up calls after their first touch point, and most sales reps take almost 10 months to be effective in their position. So what's your plan to be supported here? I invite you to not only set a goal. In the worst case scenario, 5% of people of your total practice enrolls. Conservative projection is about 18% of patients enroll with the help of the HIT team. Next, I'd invite you to create a system. After the letter goes out, then what? Are you inviting people to webinars to explain the offer? Do you have a team of salespeople or maybe your front desk receptionist to call behind them? Who's answering the phones? What are they saying? And what happens if the phones don't ring? Is there other strategies in place that will support you in reaching your goal? We ask you and invite you to check in regularly to ensure that you're within reach of your target. Reporting is an essential piece to this communications element so that you know where you need to ramp up or increase your efforts. We'll typically see most of the enrollment happen in a conversion in the first 45 days. And so if you're not close to or at break even, you need a plan and you need one fast. I did a conversion over 2 years ago with a doctor in Orange County, California. He had what he considered to be about 6,000 active patients. Most of them still had only paper charts. He'd been serving the community for over 30 years, and we had sent out a letter in the mail. We were inundated with calls, like so many calls that I had to hire more people to answer the phones. And his practice sold out in just 3 weeks. We had people calling other people that were members of the practice or patients of the practice. Before they even got a letter, they were enrolling through the HINT system. Not only could we manage the enrollments at scale and because of the volume here, but we were also able to track who got stuck in the pipeline using our sign-up attempts. And so this was a system, this system that we built was key to success. It was a system that supported, tracked, enrolled, and delivered, and allowed for a team to quickly to respond. I've also spoke to a doctor just a couple weeks ago, who in October sent out an enrollment letter to 2,000 of his patients. His results were not the same. To date, he's only signed up 100 patients from his practice. It's been a slow roll. And when I asked him, what did they do for follow-up strategy? He said that they hadn't called anybody back. They hadn't picked up the phone and even made sure that everybody got the letter to be aware of the changes that were happening in the practice. So having a communications plan is essential to the key of success for your practice conversion. The last component that we look at is onboarding. Now that you've done all of the work, you've changed the financial relationship with the patient, what's next? No one's ever taught you how to be a retail-based clinic, how to provide value to your patients without them having to come in to see you and feel like they're getting value. This is where the onboarding process comes in. You get to teach patients how you actually get to be with you, how they get to be with the practice. A lot of times doctors are concerned of overutilization, or people are going to call me outside of business hours and disrupt my life when I'm actually at home. If you set yourself up for success here by teaching people how to be with you in this new model of care, they know what they can expect from the clinic, like when you'll actually reach out, when they should come see you, They'll know how to respond to your request via text and portal messages, for emails, if they want a prescription refill, what to do if they need care after hours, and what additional value that you'll provide through this new direct primary care program. Whether it's webinars, or some of my doctors also do book clubs, track walks, are you offering coaching, in-house dispensing, are you able to draw labs? All of these things will actually start to combine up to add value to what it is that you're offering as part of the membership, and get to be reinstated. A lot of people will go in buying based upon emotion and forget what they actually have been sold. So it's your job here to do a really good part in onboarding the patient to the new experience of the client, of the practice. I work with clients to create an onboarding presentation that includes a welcome kit, of video messages that get sent out, and covers all of the elements that I just spoke to, like what to expect, how to respond, how to communicate with the practice, and all of the cash pricing that they have available. That really just sets forth the speed and tone of how to be with the practice. So just to recap for you tonight, the 6 elements that we covered here is your vision. Understand why you're doing the DPC, and be sure to share your vision. Test it out with a couple people, practice with your community, share it with your friends and family. If you can't talk about it, it's going to be a challenge for you to run a business as an entrepreneur and a doctor or provider in this space. Know your ideal patient. You get to know your audience, who you're speaking to, what language you're using, so that you can actually be able to connect with them in this new offering that you have. Time and money, do the math before you're opening. Make sure that your bills get covered, that you have enough to cover your team. You understand how much time it's actually going to take for you to be with patients, so that you know what the objective is, how many folks that you need to enroll in order to be successful or thriving direct primary care practice. Your experience, design a remarkable patient experience. Anticipate your patient needs, so that way your staff knows how to respond, your patients know how to be with you in the practice, and that you give them something that wows them so much they can't help but walk away and tell their friends. Communications. If you don't do this part effectively, then the conversion can definitely be a challenge. So make sure that you have a plan. What modalities are you going to use to communicate what the new offering is? Will you hold group webinars? Are you using email? Are you dropping mail into people's mailboxes? And who will be there to help answer the phones on the other side when folks have questions? Because you're still operating your daily business, so you don't want to disrupt it too much as you're making this conversion. And onboarding. You get to teach people how to be with the practice. This is your opportunity to demonstrate your value and also teach people how to be compliant with their care and have a successful health outcome based upon what you think the optimal patient journey may be. So if you're looking for a deeper dive and some more support or to actually convert your practice, we invite you to come to hint.com/convert. You might still have questions like, is direct primary care feasible for me? Or how do I get started? Or the tactical things about how do you actually convert your practice from fee-for-service into a retainer-based model? Where will your patients come from if they're not all coming from an existing patient panel? How do I build and grow this thing? And also, how do I demonstrate value to the patients that I have currently? And so many of us work in our business day to day, right? Even sometimes today, for example, I wake up and I start working on my things instead of working on how I actually am going to be operating in my business. So we look at some of those aspects as well. What are the systems, tools, and strategies needed, along with the tech implementation from Hint OS platform? What are some of the other resources that we could start to bring in, that plug in, that show the systems and framework and workflows that we need to build in order to successfully deliver on the other side? And what am I missing, or what am I doing wrong? If you've thought about taking the leap, but you're not really sure how to get started, the conversion overview, the conversion program may be a good fit for you. As I mentioned earlier, we take the first 6 weeks to just plan. This is when we actually design or take you through our framework, designing your offering, and making sure that we're setting you up for success. The next 12 weeks, this is what we call our enrollment stage. We'll actually help you announce the changes that are happening in your practices and provide the sales and marketing tools and team to help you enroll new members. This is a very hands-on process where we not only design the marketing assets, but we actually help speak to your patients and train your staff to do the same. And then the last 4 weeks will be through implementation, where we actually help you onboard patients so that you can begin to focus on what matters most, delivering care, your relationship with your patients. And so all of these things are based upon like the 6 principles of what I think are the foundation of business, which include the front and back office. The front office would be everything that your patients see from the outside, the membership office offering, the marketing, and the sales efforts. And then the backside, which is your experience, operations, and finance. We look at all 6 of these components to make sure that when you launch your DPC clinic, it is a success. So if you're interested in finding more, you can apply at hint.com/convert. Our first cohort starts at June 20th. We are limiting it only to 4 practices. There is a $5,000 registration fee, plus we get a commission on membership. So for our sales efforts, we'll be successful as you're successful in your practice. And if you register by May 20th, you'll receive a 50% off registration. If you have any questions, you can reach out to me directly. We'll also open up the Q&A below. If you have any questions, feel free to type them in there. I want to thank you all for your time tonight and joining us. I hope that you found some value in what it is that I was sharing with you. And again, if you hover over the bottom bar at the bottom of your screen, you can answer any questions that you may have about how to get started with your conversion, any of the points that I spoke to tonight, or what's next for you. Does your pricing vary based upon practice size? Thanks for your question. It does not. It's a flat fee for the setup. So essentially you'd be paying $2,500 to go through the planning phases with us. And then based upon your practice size would be, we're commission based on the sales. So how many patients actually are enrolling the practice in the backside. So that would be the variable cost, but the actual program taking you through designing your membership offering, putting together your communications plan and marketing collateral to help support that offering. That's all a one price element. So the variable cost is on the commission side, and then there's the application or registration fee for the planning side of things. And if you don't have any other questions, that's totally okay too. You know how to get in touch with us, keep up to date. You'll be receiving this recording in a web and an email follow-up too. So feel free to reach out to me directly, Lauren@hint.com, or to register a one-on-one call through our hint.com/convert website page. Is there no limit to size of practice? We will discuss that in the discovery call to ensure that you're a great candidate. It depends on your goals, because we can do some math based upon your current size of your practice and what you're looking to convert to see if this would be a successful program for you. And so there is a limit on size, but really it's based upon the outcome or goal of what it is that you're looking to create, right? So we'll look at that time and money aspect of things. What is the capacity of membership that you can hold? And then just doing some math around like, what is the % conversion of your current patient database based upon our estimates and process that we've seen work time and time again. How much do patients pay? So the membership fee, we have some data based upon what we're seeing across the nation. So it really depends on where you're located and what your expenses are. So again, addressing that time and money aspect. Traditionally, we see the average DPC price, I think it's like between $50 and $75. Some markets can bear more, some markets less. We also look at what you're going to bundle in from a service perspective, right? So if you're including basic labs or any other diagnostic tools, we want to make sure that those costs are accounted for. So it's individualized by each practice. I'm assuming that what is your take? We take a registration fee. It's equivalent to about $50. So upfront for you guys to get supported in the work, we're putting forward the manpower to help support the conversion process. And so again, we'd be successful or receiving income based upon how many folks that you actually have enrolled into your practice. I hope that answers your question. If not, feel free to drop another one in there for me. Jen, your question about new practices that have very few established primary care patients. So most members would be new. Conversion camp may not be a great fit for you. I would say still set up a time to talk. We can look at the details. You may want to just launch. I don't know that you necessarily go through all of the hassle of converting if you don't have a fairly established panel. It may be more beneficial. We also have a program that we're rolling out in June called the DPC Accelerator that will give you those folks who are that are established in direct primary care or coming in as a new practice, some of the framework and tools to implement best practices that we're seeing in the industry, as well as mechanisms for growth, member retention, surveying and satisfaction, technology. And so you can essentially build a new practice without having to go through all the conversion aspects of things. So I would say set up a call. You got nothing to lose besides maybe 15, 20 minutes of your time. We can look at your goals and numbers and assess whether or not you're a good fit for the program. Thanks. Look forward to talking to you. Again, nothing to lose in finding out a little bit more. Visit us at hint.com to schedule /convert to schedule a time to learn a little bit more about the program or get your individual questions answered. I appreciate you all joining us tonight and participating in this webinar, and we look forward to seeing you again soon. Thank you. Oops. How far into the process do we need to make a final decision? I'm going to assume a final decision, meaning like that you're actually going to convert your practice. I'm not sure, but my intention in deploying folks in this process is like they're sure, they're ready, they know that they want to do DPC. They just are looking for the support and guidance to get them from concept to delivery. And so if you're not completely sure, I again would invite you to schedule a conversation with me. Let's figure out what it is that may be holding you back or what information you're looking for. But ideally, the folks that participate in the camp are going from concept all the way into completion and being able to deliver direct primary care on the other side. So if you're ready or just interested, definitely use the link on this last slide to schedule a call with us. And we look forward to hearing more from all of you. Thank you and have a great night.